So there we go. So we got everything started on that. So we're going to look to approve the minutes. That there have been two corrections to the minutes that were distributed last Friday by Amelia. The first one was in the introduction paragraph. It referred to us approving the minutes of January 31st, 2024. That actually, we approved the minutes for the March 27th meeting, 2024, at the May meeting. So that has been corrected. In addition, in the members of the public, it listed Al Helfenbein and Brandon Burbidge as members of the public, and they are actually members of the committee. Are there any other changes or notations for the minutes? Okay, hearing none.
I think the minutes were pretty comprehensive. So whoever did those it was pretty comprehensive. So I commend them on that.
Yes, it's a combination of the recording and the transcription that they're employing to record our conversation this afternoon as a committee. So they do a great job putting that together. So
It really did.
Hearing no other changes than the ones previously cited, the minutes are approved by unanimous consent this afternoon. Thank you, Amelia, for getting those out to us. Moving into the agenda, where we are on the agenda. We have a couple items for today. Let's see, where are we? Go back. Approve the minutes. Okay, so the SBP updates, that's where we are.
Yes, thank you, John, for that great introduction, and welcome everyone. I just had a quick update for you all regarding the status of our enrollment portal. Our RFP was finally posted to Emma on June 17th. The link was provided in the slides that were sent out earlier this week, and the RFP will be out posted for about 45 days. We had our pre-proposal conference this morning. We've got a good number of interested vendors, and so we're happy about that. And so as far as our timeline goes, we are on track to onboard the selected vendor by September, and get all of our internal and external testing in order. And then also there were a lot of factors that were pending this contractor onboarding. So the fact that we got the RFP out is great, and everything is going according to schedule. Any questions on this?
How many vendors do you think are going to be bidding on it?
I'm not sure. I don't really know, but I know there's about 7 vendors that attended that pre-proposal conference this morning. So we're excited, and hopefully they all bid.
Yep. Good.
Yeah, Mimi, just a quick comment. I appreciated the RFP link provided. That'll take you straight out, and all the details, the technical specifications, and everything are right out there. So thanks for posting that.
Thank you. And Glenn, you had your hand up?
Without mentioning any names of the 7 vendors, are there any Maryland vendors locally representing?
I'm not sure if there are any that are from Maryland. Honestly, I'm familiar with the names, but I'm not sure where they're headquartered. So I don't think I can speak on that.
It'd be nice to have a local vendor, but I guess that's up to the local Maryland vendors.
Yeah. Yeah, thanks for that comment. Thanks. All right, so our next order of business. So today we will also have, after we discuss small group tobacco rating, we'll also have, hopefully Dinesh will be able to join us soon. I know he's not in the office, he's out and about, but he said he will try to join if he can get settled down somewhere and be able to present us with some of the Cobra related designs that he worked on. So before that, though, I would like for us to bring our attention to small group tobacco rating. And we decided to present you this information today because MHBE was recently prompted to incorporate tobacco ratings. And while tobacco rating is permissible in Maryland, our state historically did not implement these rates on consumers via on exchange or off exchange. And our original platform, which was from years ago that was bought from Connecticut, did not allow for tobacco rating on the individual market. So now that we're building our small group enrollment platform, we're reminded by MIA and some carriers that they want to impose the tobacco surcharges on and off exchange, and to incorporate this change in our business platform. So this specifically will not impact the individual market. So this is only for small group. And so the next couple of slides will cover some informational and set the context for our discussion today. So what we would like for you to walk away from is just, if you're just interested in the information, definitely take that back. And, if you also have any opinion about whether you support it or do not support the addition of tobacco rating in small group, we'd like to hear that as well. And that helps us, with our decision and how we move forward with the implementation. So for those of you in this group who are not aware of what tobacco surcharges are, it's the variation in insurance premiums based on the individual tobacco use. The intent of tobacco surcharges is to incentivize the use, the tobacco use cessation, as well as to offset the higher healthcare costs attributed to smoking. Some states follow federal law and allow insurers to impose tobacco surcharges for up to 50%, but employer wellness programs must follow certain rules for those surcharges to be legal. The tobacco rating factor applies to legal users of tobacco products, generally those 18 and older, and includes all tobacco products, except the ones that are religious or some ceremonial use of tobacco. And the maximum charge allowed under the ACA is up to 50% of the total rate. So I have an example here that says John's premium normally be $600, but he smokes, so he can be charged $600 plus $300 for that tobacco surcharge, and then that would be $900 instead of the $600. So that's how the tobacco rating works. And in general, you can avoid the rate up if you participate in a smoking cessation program through a wellness program from the carrier. And I view this as an advantage to the carriers because they can use the tobacco rates for members who smoke to control the healthcare costs, which will encourage those members to enroll in a smoking cessation program and hopefully end up quitting. And also the actual tobacco surcharge is a disadvantage to the consumer and the employer because the employer's monthly premium owed to the carrier increases until and he can recoup it from that employee's payroll. So any questions on this slide? And lastly, I want to mention insurance companies are not tobacco rating in Maryland. We just recently confirmed this with MIA. So we're currently not doing that in Maryland, whether it's on exchange, off exchange, individual or small group. So Glenn, go ahead.
You said we could make comment. I just think we shouldn't complicate things until it becomes regulated by Maryland, but that's my opinion.
So this is John. So what are the carrier, what's the carrier's position on this? Obviously, being able to get people to stop smoking, and we're using a club to do it with regards to a premium increase, probably isn't the most effective way to do it, because I would think if it's as dramatic as in the example, the smokers are just, they're not going to buy, they're just not going to get the coverage through the group, and they would be able to go and get the coverage on an individual basis, and not be subject to that question. There's a lot of logistics and cost associated with trying to figure out the tobacco use surcharge. Are you relying on attestation from an individual with a huge differential if they say yes or no? Those are complications that kind of mitigate against it, I would think.
And I wanted to point out, Susan from Care First had her hand up. If you'd like to make a comment, Susan.
Great.
Yeah, I was gonna concur with Glenn that I mean, we would have to take this back and discuss it, but until it's actually required, I don't think that this is something that we want to move forward with at this time.
Brandon, go ahead. Thank you, Susan. Appreciate that.
Excuse me, I concur with Susan. I mean, I heard we were doing that, the exchange was looking into this, but which carriers actually wanted this? I mean, we do this, this would pretty much eliminate the small group business line.
Yeah, the logistics are very, very difficult, obviously, to try to figure this piece of it out. And there's a reason that the carriers haven't been doing it to this point.
Oh, sorry, John.
That's
Michelle,
fine.
you have your hand raised, Michelle.
Sorry, I was just coming online. So let me just give a little bit of history on this, because when we started with the individual marketplace, because of the system limitation issues we had, we did not include tobacco rating. We're in a different place now in terms of our capabilities. And as we are spinning up this new system, this is currently the law in Maryland. So we're trying to be within the confines of the law as it exists today. And because this affects on exchange and off exchange, we really need the Maryland Insurance Administration or someone else to submit some legislation to change this law. But until the law is changed, we've gotten some pressure that our system should reflect the law as it is today. We can, Mimi is presenting this to everyone today. We can again take it back to our Board of Trustees and have more discussion around this, of how to, what would be the path forward. But as the exchange, we don't have the authority to regulate off exchange, only on exchange. So we can't say we're not going to follow the law, but
Right.
we have that authority to change the law because it doesn't apply only to the exchange. So we're in a little bit of a predicament here. And that's why we're presenting it, and really appreciate all feedback that we can take back to our Board of Trustees, and maybe the legislature, and see if anyone feels that this should be changed.
So I had my hand raised, and I needed to correct myself. I said the Maryland regulation, but it is a federal law, correct, under the ACA, and I realize that. I just think that Maryland, as a state, that until you feel the carriers, like the Care First representative commented, until the carriers actually see the value or choose the value of rating that way, then I understand you just want to create another open-minded position, I guess, on the backgrounded computer site to be able to have it there. I just think that if you do create it on the site, just for purposes of, you know, whoever's the vendor to do that, just don't put it out there and put it in visual view until it becomes carrier willingness to rate that way, because then it's just going to create another step, another energy, purpose, and questions for brokers to answer. You know what I mean?
Mhm.
So that's my comment.
Yeah, well, thanks, Glenn. Let me jump in here for just a second. Yeah. So Michelle, again, thank you for that explanation of the rock and a hard place you find yourself in. So from the RFP standpoint and being able to do the technical part of it, you're mandated to do that. We understand that. On the other hand, from a practical standpoint, until you can get everybody on board, you might want to have that as a component that is inactive, but planned for in the software going forward. So I think that's that would be a summary of those 2 points. I know there are some other folks with their hands up.
Yeah, Mark Katie. Go ahead, Mark.
Yeah, John, not to sound redundant, 100% agree. It would be a significant challenge for a lot of agents that and groups regarding this tobacco usage, and just agree with everything you said.
Thanks for the feedback.
I know Etna is on the call. Any insight from Etna? Do you have any position on this right now? If you don't, that's okay.
I don't, Mimi. We don't do it right now. So I'd have to look into if it's something that we would be able to do.
Okay, thank you.
Yeah.
All right, so I do see another hand up. Michelle, go ahead.
Sorry, I just want to confirm for John that, yeah, absolutely. This is something that, you know, we can build into the system, and we typically will always have a flip on, flip off switch. So if there's not a need for it, we don't have to flip that switch on. So we may have to build it in the back and just have it available.
Yeah, that's how I would see it too. Thanks for that clarification, Michelle. You know, I think we all would like to see everybody quit smoking and have a significant impact on healthcare. So that's the kind of thing the ACA got wrong, because they passed this stuff in Congress without really thinking about how you're going to implement it realistically. And the carriers confronted that early on with the fact that they just are, it's a very difficult circumstance to try to figure out. And if you've got an open market in the individual market that is not accounting for it, yet you're going to account for it in the group market, it will drive people away from the group market and into the individual market, or perhaps into the ranks of the uninsured, with a habit that's going to cost money down the road. So yeah, it's a tough position, but appreciate the opportunity for the committee to talk about it and to think about it again, because I know this was discussed many years ago when the ACA came out. But it never went anywhere for practical reasons. So thank you. Any other discussion on this topic?
I just wanted to raise one more point on a different slide, that the implementation, that, you know, how, you know, this would be coupled with some sort of wellness program from the carriers, and I don't know to what extent that they're covering all of this, which is per the CMS guidelines, there should be some form of screening for patients that use tobacco. There should be some kind of counseling that's 10 minutes each, including a telephone group, individual counseling, medications that are FDA approved. I believe there's 4 right now that are approved, and that would go for about a 90-day treatment regimen, at least 2 tobacco cessation attempts per year, and no prior authorization or cost sharing treatment. So I believe I pointed this out to see how feasible this is for carriers. And if, again, I mean, the 2 carriers have outwardly said they're not interested in pursuing this, and they're not, and they wouldn't go this route. But if there were carriers that were interested, and if they, just wanted to see what the lay of the land looks as far as implementing this guidance.
Any feedback from the carriers? I had one further point, Mimi and
Yeah.
Michelle. So this has been a federal mandate for a long time. Are there any states effectively doing this?
We know the ones that are not doing it, and that goes to my next slide, but I don't know who's effectively doing it right now. That's there are some, like Kentucky, Arkansas, and Colorado have some limited version of the tobacco rating, but to your point, that wasn't thoroughly looked into as far as who is doing it effectively.
We can follow up and get that information through our networks, because you of course have the federal exchange and then the state-based marketplaces, but we can certainly, get a pulse of what states around the nation are doing it today.
Got it. And this wouldn't be implemented until the software program is implemented in 2025, correct?
Yes, this would go along with the portal launch. If not exactly at the launch of the portal, it would probably be a month or 2 afterwards. It would be an enhancement.
And
Yeah.
if carriers are not tobacco rating, then there's no change, right? I mean, the tool will be there, but if
Mhm.
nobody's using the tool.
Right. Right. Got it.
And Mimi, this is Susan from Care First. I'm not outright saying that it's my recommendation that we wouldn't do something like that as part of this initiative, because it wasn't sitting out there in the original requirements. But I have already reached out to our public policy and mandates team, as well as underwriting, so that we can have those discussions and provide a formal response back on our position.
That's perfectly fine. Thank you, Susan.
Okay.
All right, let me. I am sorry, I got kicked out. I am back in now. I'm going to try to locate Dinesh to see if he can join us to give us the next presentation. Hang on.
Okay.
Hey, Mimi, just one quick comment before you leave this. It's Jude with Aetna. I was just double checking with one of our underwriters that has more of a national scope, and she said we are not using tobacco rating in any states across the country with Aetna.
Okay, excellent. Thank you. And that's for both small group and individual, right?
I only asked for small group.
Oh, okay.
I'd have to go to someone else for individual.
Okay, no worries. Thank you for confirming that. All right. Let's see.
I have one
am.
comment.
Go ahead.
I have one comment.
Go ahead.
Yeah,
It
Gene.
would appear to me, this is Gene Poole.
Yep.
It appears to me that from my experience working with carriers, is that if the carriers are community rating the small group anyway, are they not already self-correcting when they give their rate increases? Because tobacco is already part of the claims experience. So I would tend to think that they are already at least pricing the premium to the point that it takes in consideration smokers versus non-smokers as a percentage of the pool, you know, as opposed to just trying to circle out particular individuals to try to incentivize them to stop smoking. I would tend to think that the carriers are looking at the claims, whether it's smoker or not. They're just simply looking at the claims and setting their rates based on the claims experience, which includes smokers already.
You're right.
And I have one last comment. I see where you pulled that from, Mimi, because I Googled that question and it showed that exact slide picture. I started scrolling through some of the legal issues and some lawsuits, and I guarantee you, I think a lot of people centered around that are not going to, carriers are not going to be involved in that. But anyway, that's just another comment.
Oh, that's a good point. Thanks, Glenn. Oh, it was
This is
Sandy. You
Sandy.
had, yeah. Hi, Sandy.
Yeah. We've done this in some self-funded groups, except for they test the individuals to ensure if they're smokers or not smokers. So they give a contribution discount is what they do. The rates are the rates. You can get a discount if you're a non-smoker within the group,
Yeah.
or if you join a not program, to quit smoking.
Yep. I remember that. I remember you spin it the other way with regards to a discount for non-smokers, and how do you prove you're a non-smoker? You have to test. And the tests are not inexpensive, I don't believe.
I don't think it was that expensive. It's basically, I think it's a blow test, and they can tell.
Mhm.
At least they can tell if you've had tobacco in the last week.
Yeah. And that's where it gets a little dicey too, legally. I'm an employee, but there's no mandate that I take a blow test. Of course, I'm not getting the reduction if I don't. So that's the way they get around some of that.
Correct.
Yeah, good point. Good feedback. Thank you.
All right. Well, I'm not sure if Dinesh is having a problem logging in or what's going on exactly, but I believe this would, if we want to give him 5 more minutes, if anyone else has any other items to discuss, any questions. I believe if Michael who represents United Healthcare, if he was on the call, we would have just gotten a unanimous answer as far as the outlook on small group tobacco rating, but I wasn't able to get him on the call as well, but I will follow up with him separately. I do see Sandy's hand is up, and then Glenn. Go ahead.
I wanted to comment on the earlier thing on the RFP. We're not going to be able to respond because we aren't qualified, because the requirements within it require someone who has already done a state program, and we're local, so we haven't done Connecticut or any other state that has a program. Because of that, we're not qualified to submit a response.
So interesting, Sandy, you said that, because I was going to say, Mimi, if you could disclose the 7 RFPs, but if you cannot, I was just curious maybe why Maryland, nobody from Maryland may have put in an RFP. Now, Sandy just, closed the door on that. But, I guess my point is, I don't understand why that would be a pre-qualifier, because obviously we attempted to do it in the past, didn't get a lot of traction. Therefore, in my opinion, the three major TPAs in the marketplace withdrew. So I just don't understand that reasoning as being part of the qualifier for the RFP.
So I believe all RFP related questions will have to go through our procurement person. Her name is Sherelle. I can get you her information. I don't believe I am permitted to answer some of these questions. Not because I don't want to, but just because of the requirements. So let me just copy and paste her information here, and you can send her an email, and she will, if I am permitted to answer, she will send it to me, and I can, or someone from our team will respond. All right, so I don't think Dinesh is joining. So he was going to present on the COBRA enrollment experience, but we may have to just postpone for the next meeting when he can join us. But it looks like, hold on, I might have gotten him, but give me 1 minute. Okay, I apologize for that. We'll postpone that for next meeting, for the next meeting, and then we can go ahead and move into public comments and then wrap up, John, if that's okay with you.
Yeah, it's fun. While I was sitting here waiting, I was thinking through Sandy and Glenn's responses. And of course, it all comes down to how was the criteria established for the RFP? How was that developed? Who actually developed it? Did they develop it themselves, or did they use a template they got from someplace? There are a lot of questions around that for me, and probably for some other people on the call. But we can defer on that for a future meeting. I know the RFP is out and there's deadlines and timeframes to that. But I too would be a little, question the process a little bit here with regards to how would we eliminate the TPAs in the state of Maryland from even being eligible to do something like a billing process for small employers that they have done since the beginning of the small group in benefit process. So that raises a question for me. But we don't necessarily have to explore that today. Maybe there are other folks that can answer some of those questions. Maybe we should formulate some of those questions for them. I wanted to get my concern on the record. I think Len and Sandy stated their concerns with the process, and there may be others on the call while we're in the discussion, public comment, that would also like to chime in on that topic?
I, for one, would like to chime in because I was involved with electronic claims for 7 years. When I worked for Care First, after the insurance side of it, I went to work for the electronic claims division. And I did that for 7 long years. And it is a specialized knowledge because you're not only dealing with Blue Cross claims, Medicare claims, Aetna, all of them. The TPAs are in the best position to have the specialized training. And we're taking people that have a very highly skilled, specialized training, not only the training to do it right, but also the training to do it right well enough so they don't end up with a bunch of lawsuits all the time. So I think that if if the TPAs are withdrawing, we need to find out why they are withdrawing or what specifically excludes them and why are we excluding them, because ironically, they happen to be the best skilled people in that arena.
Thank you, Gene. Any other feedback on that topic?
Yes, just to reiterate what it was part of the, I guess, the RFP. And again, just to get clarification, Mimi said that, you know, to contact the person that's in charge of it. But I honestly think a local presence would behoove the, you know, you guys selecting a vendor, because they're very well connected with the carriers and everything else in this marketplace. So my comment would be they need to reconsider that RFP.
Absolutely.
Yeah.
I also see Mark's hand up. Go ahead, Mark.
Yeah, thank you. I'm going to go ahead a little bit against the grain here and disagree what has just been indicated. Keep in mind that I've been involved with the Maryland Exchange plus or minus since the very beginning of ACA, and I actually look forward to having an outside party assist the state of Maryland. You have people all over Northern Virginia, DC, and Maryland writing. I'm getting a lot of feedback. I'm not sure. So I have no issue.
Yeah, I'm sorry. Can you mute yourself if you're not speaking, please? Thank you. Go ahead, Mark. Sorry.
I have no issues whatsoever, excluding the 3 that keep being mentioned, because there's more than 3 TPAs in the market.
Okay. It's a valid point. Thank you.
All right. I see Sandy's hand is still up, but I'm not sure if he has already made his comments.
Any other feedback? Okay, Mimi, I think we're
All right.
getting close to done.
Yes. Well, thank you all for joining today, and we'll see you next month.
Okay, thanks, everybody. Thanks for attending.
Thank you.
Take care. Thanks a lot.
Thank you.